So welcome to this edition of Straight Talk. I'm here with Dr. Gavin Macgregor Skinner. He's the director of GBAC, a division of ISSA. Welcome, Gavin, back to Straight Talk. Good to have you again. We're going to talk about something that not many might be thinking about, but in my discussions with you, Gavin, it's big. It's the casinos and the gaming industry and how they're trying to reopen. When I think of casinos, I think of Las Vegas and maybe New Jersey. But according to you, it's bigger than that.
It's much bigger than that, Jeff. The gaming control boards actually oversee casinos, bingo halls, horse racing, any establishment that you can go to where you can actually put money down and have a bet on some outcome.
Well, let's talk about that, because the cleaning industry, and we think about infection prevention and this coronavirus, trying to keep its impact to a minimum. Tell us about the status of casinos now. I believe they're starting to reopen.
Yes, they are. Interesting that casinos have been closed, most of them since March. So some of them are coming up to nearly 80 days of being closed. Imagine the economic, the emotional stress and fatigue, but impact that's had on all the employees. Now, some casinos are opening today, Thursday, June the 4th. Most of the casinos in the states that are opening under the second phase of the state's reopening plan. This is extremely important because people, the employees, the patrons that go back to these casinos want to know, if they go back, are they safe?
Yeah, and I know that you've mentioned previously that, hotels that might have some type of gambling in them, or bingo halls. I know near me here in Columbus, we have a casino, and down the road, there's a place that does horse racing. So it's huge, and we have to think about what they have to do to reopen. So tell us what they're doing now to reopen, to make sure they're safe.
That's a great question, Jeff, because the state gaming control boards and again, a number of states now have issued very detailed outlines of what's required for reopening. So each casino was required to submit a detailed health plan. That health plan had to ensure there was hygiene measures such as hand washing stations, face masks, gloves, and face shields. They met the appropriate cleaning and disinfection of high touch points, but also the physical distancing measures need to be in place and also monitored and enforced. So again, the reopening right now of casinos, health and safety of guests and employees, and also the building is at the forefront of everything that casinos need to be doing. And that's very much stated by the State Gaming Control Board guidelines.
Yeah, all that takes training, I'm sure. And so for these casinos to implement these health and safety procedures to resume, what have they done as far as training their people and their cleaners?
The Gaming Control Board guidelines for reopening for casinos are very specific in ensuring that the gaming operations do not compromise the health and safety of employees or even the patrons. And again, the training requirements are very specific and stated within these guidelines that all employees are trained on COVID-19 safety and disinfection protocols. There's additional comprehensive training that's required for employees who work in areas with frequent patron contact. That includes housekeeping, food and beverage, internal maintenance, hotel operations, casino operations, security. Now, this training can be conducted in person, online, by video, or in writing. And in most of the gaming board guidelines requirements that I've read, it says the training should be available in English and Spanish. So for an example, to meet these training requirements, the ISSA GBAC Fundamentals online course for COVID-19, it's available in English, Spanish, Portuguese, Polish, and Italian, would help meet these requirements.
All right, so we know that the training's there, and ISSA and GBAC are helping with that. We all hear the term, the new normal. What does that look like for casinos, the new normal?
Well, the new normal for casino, we're seeing a lot of new set of protocols and procedures being put in place. And with that means a lot of training for employees. And these new protocols and procedures have been designed in conjunction with, again, medical and scientific experts. This is a brand new relationship for casinos. And they've been put together to mitigate the spread of the virus, to protect customers and employees, and then also rapidly respond to these potential new cases. So when we look at what this new normal looks like, we're seeing as employees arrive for work, they're getting surveyed and temperature checks. We're seeing that as they're now reopening, casinos are reopening, they have to offer employees COVID-19 testing. Employees now on the floor of the casinos, the roulette, the poker, the craps, the gambling, all the different gambling activities that you could do, requires that the employees wear, again, face masks or face shields to protect the eyes, nose, and mouth, gloves. They're encouraging the guests are strongly encouraged to wear a face covering or a face mask, and that these face masks need to be provided free of charge. They have to, ensure there's physical distancing. They use stickers on the floors, but they also use floor guides, people that actually walk around the casino and remind people to maintain that physical distance requirement.
Yeah, I know when I'm out at a store or someplace in public, I don't go out too often right now, but when you see those things on the floor and you step past it too close to someone, it's like, oops, I made a mistake. I can't imagine what the casinos are going to look like. I'm not a gambler, but I do go to Vegas for trade shows, as many in the industry do. And I see these busy casinos. It's going to be a bit different when I see them again, I'm sure.
It is, Jeff. And we're seeing, again, the use of physical barriers like plexiglass being used. We're seeing them, casinos now, the photos that I've seen, especially Las Vegas just opened today, standalone hand washing stations, for example. A lot of what you do when you check in or when you're making a transaction, this is contactless transactions using your own personal cell phone. We're seeing that there is a need for, let's say ordering food, the use of digital menus, again, using your personal cell phone and things like QR codes. We're seeing that that casinos are trying to minimize congregation, crowding of guests, and they can do that through text messaging and other notifications. And we're also seeing the need now for casinos to establish new relationships. These might be new relationships with hospitals or local health departments. They may be asked to assist with contact tracing to support those epidemiologists or disease detectives, or even some casinos have been asked by their health departments or by their states to set up special isolation rooms if any of the patrons or guests develop clinical symptoms or have symptoms of COVID-19 while they're actually in the facility, using the facilities to do what they do.
Yeah, crazy world we live in. I guess I'll look forward to the time when we're in Vegas together at a trade show where we will not shake hands. So,
well, we're
Gavin,
definitely moving in that direction.
We are. Well, thanks for being with us today.
You're very welcome, Jeff.